So, good evening, everyone. Are we all in? Do we all want to get in as we talk about this exciting session about men's sexual health? I can see all the ladies here, but where are the men at? Thank you all for joining us today as we talk about this provocative session called Gynecology. It's aptly named GUY, Gynecology. Why men's health is important. We don't talk about it. We will be talking about it today. It might be provoking. It might get a few minds stirred. I heard a few colleagues telling me they might turn the other way when we discuss this, but this is what we're here for. It's all about men's health today. So I think we can get right into it. My name is Dr. Hinjal Bhatia, Project Manager at AHP, and I will be your moderator for this session. Yeah, okay. As you all can see on this video, nobody understands why sperm count is going down. And sexual and reproductive health is a fundamental human right, and all people, regardless of their sex, social status, are entitled to this. Women have a lot more enjoyment of their right, but men do not have this right. There is a lack of data that build evidence for the engagement of men. And it's difficult, but gender equality needs to be established now. And without the involvement of men, it's worrisome. Very little documentation is on this, and we need to take action now. So I can say in short, men's health is a bit of a mess. As you can see the statistics, globally, we spend about $26.6 on women, none for men. In Africa, we spend about $6 on women, none for men. That's a very disturbing fact, in my opinion, and I think we need to do something about this. Yes, so men versus women. I think we need to stop the versus and we need to make it equal now. There's a fact sheet on WHO about sexual reproductive health about women, none for men. We have so many articles on women about sexual reproductive health, very limited for men. Policies and framework, none for men. Plenty for women. Conferences around sexual reproductive health in men, apart from this one. Can you name me any others that we're having? For women, unlimited. So as men, there's a critical need that needs to be met worldwide. And for women, SRH has traditionally been perceived as a women's only identity, but we're here today to change that. And AHP is asking for a call of action. And for those of you who are interested in changing the landscape of men's health, we can drive this. Why is it important? Why is men's sexual reproductive health important? I had a very interesting conversation with a fellow gentleman outside, and he told me, oh, will you be talking about the blue pill? Will you be talking about Viagra? And I said, men's sexual health is not about Viagra. There are many, many things that are involved in men's health. What can we do about it? We have infertility. We have men's sexual dysfunction. We have men's sexual health and their broader well-being. We have supporting contraceptive use. We have family planning. We have sharing responsibilities around sexuality and reproduction. It's not just about the blue pill. It's much more than that. And we are here today to discuss this. So on that note, allow me to introduce our esteemed panelists who will be joining us today. Please come up as I mention your name. Dr. Frederick Oluga. A round of applause as there he is. We all know him, Director of Nairobi Metropolitan Services. We have Professor Khalid Dabis, who is joining us online. He is the President of Africa Gulf Society for Sexual Medicine. We have Dr. Beatrice Getumia. She's from AMREF. We have Dr. Simon Kigondu, President KMA. And we have one more speaker, Dr. Kelvin, but he is running a little late. As we wait. Great, thank you so much. So, Dr. Oluga, the floor is yours for the next 10 minutes.
Oh, Thank you. Thank you, Dr. Injal. Good evening, everyone. First and foremost, I have to say that I am a physician, and my knowledge about reproductive health may not be very accurate. But I am here in my capacity as Director Health for Nairobi, and I think you saw something called co-partners for the conference. So we've been having this discussion with Africa Health Business from February of this year. And on two reasons. One is because of the concerns around men and health generally, especially health access, health awareness, and health consumption. And two, because it is increasingly a concern around issues of cancer, especially prostate cancer, which is related to reproductive health, HIV, STIs, and of course, participation of men in maternal child health, newborn, which is also reproductive health. So that, given that background, I think I have to, first of all, be very shocked that sperm count is going down worldwide. I don't know whether Makove has an answer for this. I think the men, you either are not having enough, so, you know, the testes is atrophying and not producing anything, because then there's nowhere for whatever is being produced to go to, or you're having too much, and therefore the count per session is lower. That is not scientific. I think there must be a scientific reason, which I will leave for the urologist and for our good friends, the reproductive health experts, to tell us. Having said that, for us as representing government or Ministry of Health per se, our biggest contributions, and especially the aspects that we would love to engage as far as input of stakeholders, Africa Health Business and all the stakeholders who are here, is basically participation of men in their own awareness and prevention of reproductive health care issues across the range. And particularly, of course, wellness of men and wellness of men while participating in the reproductive health also of the other issues that I mentioned. In Nairobi, for example, we have around 168,000 persons living with HIV. Out of that number, 48% of them are men. And if you look at our control, what can I say, viral loads, for example, for HIV, you find that the men are doing worse. If you look at issues of the 4,000 cases of TB that we get every year, men is like 70% of them. And also issues of cancer. And so we are increasingly being aware that we must take steps and measures to put up necessary policies that are going to make men participate, not just in their own health, but in the whole spectrum of reproductive health. I think I will leave it there so that my colleagues who are in the practice space of reproductive health can also chip in, and then we can engage with you and with all of you on some of these steps. I know that the Ministry of Health, I don't know whether they had talked, last year there was a launch of the guidelines for reproductive health. And if you look at it, you can see the very few pages that are talking about men. Yeah, out of, I think less than 5% of that whole guideline is talking about men. And so I think this is a timely conversation that even ourselves, especially those of us that are in the policy space, that then we can start to give enough credence to men as far as awareness, prevention, and healthcare programs are concerned. And that is really why, for me, I am here. Thank you.
Thank you so much for that. I like what you said, that only 5% of those pages were talking about men. So let's just think back. Urology deals with urinary tract and andrology addresses infertility. But there is no medical specialty that proactively, deals with men's issue like how gynecology deals with women. So I think there are a lot of things to think about and what we can do to change this. And I'm glad we're having this conversation. So thank you so much, Dr. Oluga. Moving to our next speaker, I believe is joining us online, Professor Khaled Dabis. Floor is yours. Thank you.
Mr. Chairman, honorable colleague, it's my pleasure to share with you my presentation about sexual health, reproductive health, and the new threats and new chances. Can I have my slides projected, please? Okay. So let's move to the next one. Next slide, please. Yes, men reproductive health comprise of two main items: sexual health and sexual medicine, and reproductive health and reproductive medicine. Next, please. So we have a new threat that visited the world in 2019 is COVID, or SARS-CoV-2, which infected about 15% of the world population, and it has early and late consequences. COVID-19 or SARS-CoV-2, we started by thinking it's a respiratory virus. Then after we learn, it goes also to the GIT. So is it a GIT virus or two types, or it's a pan-body virus? Next, please. What we found that COVID-19 virus go to every part of the body, and especially in the male reproductive system, it's found in 17% of the infected. So it goes to the testis, seminal vesicle, prostate, penile, cavernous tissue, and also to the brain, as the brain is part of the male reproductive health. Next, please. So what is the effect of COVID-19 on the testis? Studies showed that the virus stay up to 20 days after complete recovery. And this brings us to an important question. Is it infectious? Nobody knows. No studies has been made if you can infect COVID, your partner, with semen. So should male use condom or not? That's a not answered question yet. No relevant studies on this type of protection. COVID affects semen quality by reducing the number of sperm and the motility. The mechanism postulated orchitis, oxidative stress, and apoptotic pathway. So COVID-19 causes early and delayed damage to men's reproductive health, especially found in young population, by causing infertility through reducing sperm count and motility. Next, please. Next. So another pathway is the effect of COVID and the hormonal changes that happen with this. Studies show that sign of hypogonadism in post-COVID male patients. COVID-19 causes hypogonadism either directly by affecting the cytokine release or inducing an autoimmune reaction in the testes, which affect not only the seminiferous tubule, but also the Leydig cells, which produce the testosterone, the male main hormone. Another mechanism is that COVID-19 affects the pituitary with decrease in LH production that inhibit testosterone production, with its effect on sperm maturation and sexual desire and performance. Next, please. So there is a need for lab diagnosis and follow-up for all male patients that catch COVID-19, or if they catch it in the future, we need semen inflammatory marker, procalcitonin, C-reactive protein, and we need the seminal cytokine, interleukin alpha beta, and tumor necrosis factor alpha, besides the normal semen analysis for count and motility. This should be followed up at 3, 6, 12, and 24 months. Next, please. So what about COVID and sexual medicine? It is found that COVID patients have 5-fold likelihood to develop erectile dysfunction. 5-fold. The possible mechanism for erectile dysfunction include endothelial dysfunction, low testosterone and hypogonadism, brain affection, and the heart factor. And we will discuss those. Next, please. The endothelial function is the most important for erectile function, as the neural impulse to the blood vessel makes the endothelial cells in the cavernous body release nitric oxide and start the erection. Without this pathway, erection doesn't happen. So virus inflammatory cytokine disrupt, damage, and fibrose the endothelial cell lining of the blood vessels and the cavernous tissue, leading to disruption of the nitric oxide pathway needed for erection. So they got erectile dysfunction. Next, please. Also, COVID-19, SARS-CoV-2 affect the brain and mental health. And the brain and mental health is part of the process of male reproductive health or male sexual function. So it causes depression, anxiety, premature ejaculation, reduced libido and orgasm due to affection of the autonomic nervous system by the virus. Next, please. Other factors that contributed to post-COVID-19 erectile dysfunction is low oxygen level in the blood due to lung fibrosis, and oxygen is very important for the process of erection and release of nitrous oxide, and post-COVID-19 fatigue, low sex drive, and depression. Next. So summary of the COVID-19 effect on male reproductive health: it causes sexual dysfunction by 5-fold, especially in young population, premature ejaculation, low sex drive and difficult orgasm, and it causes infertility with decreased semen parameter, especially count and motility. Next. So the private sector have a role to manage post-COVID-19 late sequences or late sequels on male reproductive health. We need a huge number of male reproductive health clinics, upgrading labs, cardiology clinics, and neurology clinics. All is needed to manage and treat the post-COVID-19 late sequences, which put a lot of burden on the current insufficient sexual and reproductive health system in Africa. Thank you.